Hello, my name is Shannon Roth. I am with the Division of Physical Therapy Education at the University of Nebraska Medical Center. Welcome to the training series for volunteers in disaster shelters. In this video, we will demonstrate how to transfer an individual from a wheelchair to the cot using a standing pivot technique. This technique may be useful for someone who has weakness in their legs or who may need some assistance with balance during the transfer. Position the wheelchair several inches away from the cot and midway between the head and foot of the cot. Once the wheelchair is positioned, lock the brakes on both sides. Remove the individual's foot from the leg rest closest to the cot and then swing away or remove the leg rest. If you remove the leg rest, place it somewhere so that it will be out of your way during the transfer. After removing the leg rest closest to the cot, unlock the brakes on both sides and reposition the wheelchair so that it is closer to the cot and still at a slight angle to it. Once repositioned, make sure you relock the brakes on the wheelchair for safety. Next, remove the individual's other foot from the leg rest and then swing away or remove the leg rest. Again, if you remove the leg rest, make sure to place it somewhere so that it will not be in your way during the transfer. Fasten a gait belt around the individual's waist for safety. Thread the head of the belt through the teeth of the buckle first, then through the other end. Make sure the belt is nice and snug. Ask the individual to then scoot forward in the wheelchair. Before standing, ask the individual if they have one leg that is stronger than the other leg. If they do, have the individual place the stronger leg slightly back and closer to the wheelchair compared to their other leg. Both feet should be flat on the floor, about shoulder width apart. This position allows the stronger leg to raise the body most effectively to a standing position. If the individual does not state having one leg stronger than the other, still use this leg positioning strategy. Next, to help the individual stand, have them place both their hands forward on the armrests of the wheelchair. Then place your hands on the gait belt on either side of the trunk using an underhand grip. Instruct the individual to lean their trunk slightly forward and to push through their arms and feet to stand. When ready, encourage the individual to bring their nose over their toes. Use terms such as ready, set, stand, or 1, 2, 3, stand to coordinate with the individual. Make sure that when you are helping the individual get to a standing position, that you are not simply trying to pull the individual up by the gait belt. This is uncomfortable for the individual and increases your risk for injury. As you help the individual come to a standing position, use the transfer of the weight of your body as it moves from a mini squat position to a standing position. By keeping your body close to the individual's body, you minimize the amount of work you have to do. Once the individual is standing, have them place their hands around your arms just above the elbows for support. Do not let the individual place their hands around your neck for support. The individual then pivots or shuffles their feet toward the cot. When the individual feels the back of both their legs touching the cot, have them reach back with one or both hands for the surface of the cot as they slowly lower to the sitting position. As you help the individual lower to a sitting position, it is important for you to keep your lower back straight to prevent any injuries. If needed, help the individual scoot back on the cot and then remove the gait belt from their waist. To help transfer some individuals, you may need to block their weaker leg by placing your foot along the outside of their foot and placing your leg against their upper shin. Make sure your other leg is positioned shoulder width apart and slightly behind the leg that is blocking the individual's weaker leg. Then place your hands on the gait belt, encourage the individual to lean forward, and coordinate together to come to a standing position. Once the individual is standing, have them place their hands around your arms just above the elbows for support. The individual then pivots or shuffles their feet toward the cot. As the individual pivots their feet toward the cot, you may need to keep the weaker leg supported by having your leg against their upper shin to keep the leg from buckling. When the individual feels the back of both their legs touching the cot, have them reach back with one or both hands for the surface of the cot as they slowly lower to the sitting position. As you help the individual lower to a sitting position on the cot, you may still need to keep the weaker leg supported with your leg. If needed, help the individual scoot back on the cot. After the individual feels comfortable, you can remove the gait belt from their waist. Thank you for joining us. We hope that you find these techniques helpful as you provide assistance to individuals who need help with transfers.